So it's a basically cancer of plasma cell. What is cancer? Cancer is uncontrolled growth of any cell. Multiple myeloma, the cell being plasma cells. So multiple myeloma is a cancer of plasma cells. Hence, it is a type of blood cancer. Now, plasma cells produce protein, and these cancer cells also produce protein in large numbers. So this protein can be of high chain or light chain. So these heavy chain or light chain proteins can cause damage to the bones, can damage to the kidneys, and it can cause the hemoglobin count low. Way of presentation of multiple myeloma can be different. You have a patient presenting with backache, you can have a patient with kidney ailment coming to you, or you can have low hemoglobin. So basically, the presentation of multiple myeloma can be bony, or it can be renal, or it can be low hemoglobin, or it can be with infections. A patient can be presented with only bony lesions or the backache, or they can have combination of these symptoms. Either means the kidney is also involved, the bones is also involved, and the hemoglobin is also down. And sometimes they become infected. So they come with fever, with all these symptoms. So the symptoms can be varied. So we get referrals from these physicians or orthopedicians or the nephrologists to have this evaluation of multiple myeloma once they suspect it. So these are the associations, but whether it will lead to multiple myeloma, it's not very sure. So what we have find associations is if the patient is smoking or the tobacco intake is there, or the patient is exposed to pesticides, or patient is exposed to radiation. In these group of patients, we find the cancer is linked a little bit higher sides. The overuse of pesticides or the overuse of near the radiation, or the patient having alcohol. Not multiple myeloma, various other type of cancers also. World has progressed in multiple myeloma in leaps and bounds in last 10 years. But now we have at least 3 to 4 lines of therapies. What does it mean? Multiple myeloma, although we say we will bring the disease under control, it's not a curable disease. It's a very slow growing tumor. So slow growing tumor means if you are diagnosed multiple myeloma today, that means the myeloma in your body has been there from last 6 months to 1 year minimum before it gets diagnosed. It's a non-curable. Non-curable means cure. What do you mean by cure? Cure means if I have given some therapy to a patient and that disease is not going to recur again ever in life. If I have given treatment to a myeloma patient, the disease should not come back. But it's not like that. Disease will remain under remission for a long period, maybe 2 years, 3 years, 4 years, 5 years. But in majority of the patient, the disease will come back. 99% of the time, it is going to come back. I said 3-4 lines of therapy means at least 3-4 times we can suppress the disease and the lifespan of the patient is increased. So very good treatment available. Whatever available, 90% of the drugs, whatever available in the US or Europe, it's available in India. And the good part, we have got generic medicines.
Oh.